In this course, we will cover the following medication management topics: managing medication, drug names including brand names, generic names, and chemical names, potential drug name complications, duration of drug treatment, effect on weight and vital signs, and common adverse side effects of medication. Managing medication for the elderly is a big responsibility, primarily because of the importance of taking medicine in the way it is prescribed by the physician and pharmacist, or directed by the manufacturer. In the first part of this training course, we will cover general medication management information. Incorrect use of a medication, or combining drugs without careful consideration of the impact on a senior, can result in significant medical problems, hospitalization, or even death. No detail is too small when addressing prescriptions from the doctor or instructions on a medicine bottle that comes from the pharmacy. Medications must be taken as directed for the safety and well-being of the individual taking the drug. Let's do a quick review of the information that must be included in a medication instruction or prescription. Remember, there are 5 pieces of information that must be present before you can assist a client in managing medication. Make sure as well that the instructions are clear and that they make sense to you. In other words, if you know that a medication like digoxin has been given to a client in a dose of 0.125 milligrams, and you now see instructions that read 1.25 milligrams, you must be attentive enough to catch this difference and clarify it with the physician or pharmacist. Always ask for clarification if you see anything on a prescription or drug instruction that doesn't look quite right to you. The indication is the last piece of information on an instruction or prescription. It gives the reason the client is being treated with this particular medication. Drug name. This is the first that appears on an instruction or prescription. It can be a brand name, generic name, or a chemical name. For example, Benadryl is a brand name, whereas diphenhydramine is a chemical name. The dosage follows the drug name on an instruction or prescription. It indicates the amount of medication in each pill or dose, not the number of pills or doses in the entire prescription. The frequency of administration is the next piece of information on an instruction or prescription. It tells how often a drug is to be given and at what times of day the drug should be administered. The next piece of information on an instruction or prescription is the route of administration. It details the method for administering the medication. The indication is the last piece of information on an instruction or prescription. It gives the reason the client is being treated with this particular medication. Also remember the following medication management tips. Always employ good hand washing technique when managing medications. Use sterile technique when indicated, particularly with eye drops. Do not transfer medication from one container to another for storage, as this can cause confusion about the instruction or prescription and the pharmacy label that lists number of pills, among other things. Never mix medications in a container unless it is to give the medicine to a client. And refer back to this course anytime for complete medication management techniques. In this part of the training course, we will discuss drug names. All drugs or medications have at least 2 names, and sometimes more. One is the name that describes the chemical makeup of the drug. One is the generic name, and the others are brand names given to the drug by the manufacturer. The brand names are generally the ones used in marketing and advertising. For example, Lasix is a brand name for the chemical name furosemide. Diphenhydramine is the chemical name for what is commonly known as Benadryl, the brand name of the medication. Medication instructions or prescription labels may use either name, or in some cases, dual names of a medication with one listed below the other in smaller type. Sometimes you may see a third name for a medication when the pharmacy fills a prescription with the less expensive generic form of the drug. This can be confusing for both you and your clients. Brand names are more familiar and easier to remember than chemical names. Using generic medication adds a third name to remember. These generic names are considered to be a type of brand name. Remember to use your guidebooks or a trusted internet website if you've got questions about a drug name. Here is one example of a drug that has 3 different names. All 3 of these are the same medication, but the 2 brand names are made by different manufacturing companies. The drug name you may have heard, Procardia, is the same as Adalat and nifedipine. It can be very confusing. So how can you or your client possibly remember all of these names and medications? You can't. That is why you rely primarily on a pharmacist. You can, however, also refer to medication manuals that are published every year with updated information, since new and improved medications are being developed on a regular basis. You can also go to trusted websites like WebMD.com and Medline Plus for reliable current medical information. On WebMD, you can even get help identifying medication by the color, shape, and size of the pill. The Physician's Desk Reference is a drug encyclopedia that includes medication listings by chemical name, brand name, generic brand name, manufacturer, primary action, and picture. Within the pages, there are extensive descriptions of how each medication works, including possible side effects, situations in which the drug should not be administered, or contraindications, the chemical makeup of the drug, and much more. You can also find this information at webmd.com. Another excellent source of information is the Nurse's Drug Book, a smaller but equally informative handbook. These are great learning tools, but for the average caregiver, senior, and staff member managing medication, the 5 key items on the medication instruction or prescription are still the most important to have at hand. When looking at medication names, you may find that there are a few that sound or look very similar to each other. In this section, we will discuss potential drug name complications. If you have any questions about what you see in terms of a drug name, especially when compared to the dose, frequency, route, or indication, ask another caregiver or nurse to double-check what you think you see. For instance, if the medication name appears to be Vicodin, but is delivered in drops, then there is something seriously wrong with the prescription. If the name looks like Vicodantin, you may be correct to think it is supposed to be Vicodin, but it may be a new medication you haven't heard of yet, or perhaps it is a misspelling or bad handwriting. Either way, you need clarification to make sure the medication is taken correctly. Incorrect spelling of a medication name is a very common source of medication errors. This is usually caught by a pharmacist before a prescription is filled and passed on to a client. Any lack of clarity must be addressed immediately because a medication error can be a life or death situation for an elderly client. As with some of the examples listed above, medications may sound alike but be completely different, or they may represent the same drug with different manufacturers who have used similar names. Pharmacists are your partners in caring for elderly clients. You can feel confident that the pharmacist will help you to ensure that both prescription medications and over-the-counter drugs are taken accurately and safely. Some medications are given for short periods of time. In other words, the client should only take the medication for a specific length of time. The duration is usually limited to a specific number of days or weeks. Let's look at some examples of duration of drug treatments. The following medications are often given for shorter lengths of time, rather than on an ongoing basis: antibiotics, anticoagulants, antidiarrheals, antiemetics, antipyretics, and cough or cold preparations. In Part 5 of this training course, we will cover the effect medications have on weight and vital signs. Because medications often affect the person in dramatic ways, state and federal regulations require you to closely observe clients and documentation of changes in physical, mental, emotional, and social functioning. When unusual weight gain or loss is noted, or a decline in the client's well-being is evident, the client's physician and other appropriate parties need documented evidence of this change. It is up to you, as the caregiver assisting with medication, to carefully track weight and vital signs, so you can provide that documentation when it is needed. You should be trained in taking accurate vital measurements and documenting the results in the client's record. The client's vital signs and body weight are objective measurements that can be important signs and symptoms. Each client's record should include data obtained on a regular basis so that comparisons can be made and changes easily identified. Any staff member who is responsible for measuring vital signs and weights must be appropriately trained and capable of performing the duties with accuracy. When using scales and mechanical lifts that provide weight measurements, proceed with special caution, and remember to zero out the system prior to assisting the client onto the scale. Be sure also to subtract the weight of a wheelchair or a walker if the client uses it while on the scale. You can write the weight of the equipment on a sticker or a piece of white tape that can be attached directly to the device. This technique will save time and effort in assessing future weights and add to the accuracy of the process. When taking vitals, make sure that the blood pressure cuff is in good working order and that the valve on the bulb opens and closes securely. Be alert to any precautions or contraindications before applying the cuff, such as a dialysis shunt, bone fracture, blood clot, arm pain, paralysis, etc. Use the appropriate size cuff for very large or very small clients. Many clients who require close blood pressure monitoring have their own electronic systems and keep a record of their blood pressure and heart rate, but it is still a good practice to monitor the process and possibly take a separate reading to ensure accuracy. A list of medications that can cause changes in blood pressure and/or pulse may be readily available to caregivers for quick reference through your pharmacy. Additionally, the medication instruction or prescription will identify any drug prescribed specifically to treat blood pressure imbalances. Clinical signs of high blood pressure include headache, dizziness, or loss of balance. Signs of low blood pressure include fainting, decreased responsiveness, or extreme fatigue. Some medications also require routine laboratory tests to monitor a client's response to a drug or determine if a therapeutic level of the medicine is in the bloodstream. This is common with blood-thinning drugs, heart medications, and drugs that impact the neurological system. Physicians generally want to review lab results and vital sign measurements in order to see the full picture of how a client's system is responding to a medication. Every drug or medication has possible side effects. These side effects include any unintended ways that a medication can impact a person's system. Not everyone who takes a medication will have the same response to it, and while side effects are always possible, not everyone taking a drug will experience them. It is impossible for anyone to know all of the potential side effects of every drug on the market, especially since new medications are introduced every year. Use your reference manuals if you want in-depth knowledge of the side effects of a particular medication. But also, be aware that there are some general adverse side effects that are common to many drugs. One key thing to remember is that any change in a client's well-being, behavior, or vital signs is important information that must be reported to a physician, the client's family, or another responsible party. There are many systemic changes or symptoms that can be caused by medication. These are often made more significant when a medication is not taken according to prescribed directions. Overdosing on medication can result in many serious complications. For example, Coumadin is a blood thinner used to prevent or decrease the incidence of blood clots. A person who uses too much of this drug may develop bleeding problems, causing the blood to clot slowly or not at all, and the pulse to drop below 50 beats per minute. Digoxin is another medication that, given too high a dosage, causes toxicity in a person's blood level. Toxicity can cause confusion, decreased alertness, nausea, dizziness, and other abnormal signs. Adverse side effects can also result from an insufficient amount of medication or from missed doses. For example, seizures are often treated with a medication called Dilantin, but low levels of this medication will allow seizures to occur still. Another example is Lasix, often prescribed for excess fluid in the body. Under-medicating allows significant swelling to continue. Sometimes a client has to live with the side effects of a drug, especially if the medication is controlling the disease process it is designed to treat. In other situations, side effects of a drug are so severe that the medication must be discontinued immediately for the safety of the person taking it. For example, a client may have a reaction to a medicine that includes lightheadedness with every position change, causing him to fall several times. Such a medication should be withheld and the physician should be notified immediately. When a reaction occurs, steps should also be taken to ensure that the client doesn't use that medication again, such as informing the pharmacy that future orders for the drug should not be filled. Sometimes a client forgets about a drug allergy or sees more than one physician without notifying each doctor about potential medication issues. Additionally, clients may not be aware of classes of medication and the fact that a drug can have several different names, so he or she might take the same medication again without knowing it. Notifying the pharmacy of drug reactions is always a good safeguard against potential problems. This table contains a list of some of the most common adverse side effects. Many pharmacies now have computer systems that warn the pharmacist of negative side effects or of allergic reactions experienced by a person. These systems often stop a prescription from being filled. Such systems will also notify a pharmacist of potential drug interaction problems when a client is taking multiple medications, often the case for seniors. With this information, a pharmacist can call a physician directly for new orders. A severe allergic reaction to a drug is called anaphylaxis, or anaphylactic shock. In this state, a person may lose consciousness and his or her body systems will slow. This can begin with sneezing or mild shortness of breath and then rapidly progress to wheezing or inability to breathe, a severe drop in blood pressure, and a weak, thready pulse. Though rare, this is a life-threatening situation. This can be fatal if not treated immediately. It is an emergency. Call 911.